um, cardiology, hematology, sorry, cardiology, critical care. Today we're featuring hematology oncology. Tomorrow we'll be featuring GI. And I'm very honored to welcome all of you on behalf of the ACP Florida chapter. It's really great to have such a great attendance, as well as this awesome group of speakers and our amazing moderator as well, who will be leading today's event. So this webinar will be recorded and later on posted in the Instagram account for the ACP Florida chapter. Now I want to introduce Dr. Zain Barakat. She is our now newly appointed co-chair of the Council of Residents and Medical Students for the Florida chapter. She's a PGY2 in Lakeland Regional Hospital, and she's just honestly the best. So Zain, thank you so much for moderating and hosting today's session. Alrighty, thank you.
So much, Dr. Mercado. Good evening, everyone. Thank you all for joining us today. This is a unique opportunity to gain insight from some of the foremost experts in the field of hematology and oncology. Like Dr. Mercado said, my name is Zain. I'm an internal medicine resident at Lakeland Regional Health, and I am the co-chair of the Council of Residents for the ACP Florida chapter. I'll be your moderator today, and I'm very excited to guide you through this informative session and help address any questions that you may have. So tonight, we're going to dive into the world of hematology and oncology, focusing on what it takes to excel in these specialties and what fellowship programs look for in candidates. Whether you're just starting to explore your options or you're already in the application process, this webinar is designed to provide you with valuable information and inspiration. I'm thrilled to introduce our distinguished panelists, Dr. Armaghani, a leading breast cancer oncologist and core faculty member at the University of South Florida Moffitt Cancer Center. Dr. Jain, a distinguished leukemia and myeloid disorder oncologist and associate staff at Taussig Cancer Institute, Cleveland Clinic in Ohio. And Dr. Meng, a leading genitourinary oncologist and assistant professor of medical oncology at Ohio State University. We're very excited and honored to have you all with us today. As for the audience, we do encourage you to actively participate, submit your questions throughout the webinar, and we'll address them throughout the Q&A session. So let's get started. One of the most exciting and interesting questions is probably what inspired you to pursue a career in hematology and oncology? And any of you can answer, or all of you.
I can go first. So I specialize in breast cancer, solely breast cancer. But when I was an internal medicine intern, I didn't actually know. I knew I wanted to specialize, but I didn't know exactly what I wanted to do. So I thought maybe GI or cardiology, something, but oncology wasn't maybe on my radar completely. But my first rotation as an intern was actually on the inpatient hematology oncology ward. And at that point, after that 1 month, I was pretty convinced that that's what was the best fit for me. But I kept an open mind throughout my entire intern year to rotate through all the other specialties and get more exposure to really everything before making a decision by the end of intern year that I think, HEMONC is really what I want to do. So it was really early on in my intern year. And then, I kind of finalized that decision by the end of that first year.
Thank you, Avan. I mean,
Thank you so much.
Yeah. Yeah.
Yes. Go ahead, Dr. Jain.
Yeah, I can say for me, if I'm being completely honest, it was a little bit of process of kind of exclusion. I excluded some of the things that I did not like GI and cardiology. I'm not a very procedure-heavy person. And then in residency, I was exposed to a lot of cancer patients, and I started doing some cancer research. And then even though my close one wouldn't like me to disclose that, but one of my really close family members was diagnosed with leukemia. And then at that point, I never looked back. So.
Thank you for sharing that.
So for me, I was inspired to do oncology by the early stage because when I did my PhD study at the University of Louisville, my project is about the neurotrophic factor. And I find those animal model developed a kind of the solid tumor. That is the start of my research interest. So since then, I did more and more research about the oncology. That is why I end up interested in that. I think that is also an important reason for you to make the decision which specialty you want to go for, because everyone has different experiences past. If you have a more accumulation or like achievement in some area, maybe you can save some time or get more credits on that field. So yeah, that is how I end up with oncology.
Thank you. Next question. Can any of you share a story about a patient in your career that has profoundly influenced your approach to practicing medicine?
Yeah, I mean, I graduated fellowship last year, and next week would be it'll be the end of my first year as a practicing leukemia physician. And I think just treating leukemia, it's a lot of patients I see almost every day. Some of these patients are really young and they've been through multiple cancer treatments. So my first leukemia patient was a really young female, like less than 40. She had battled breast cancer already. And it's just the beauty of going with them on this journey and then handing them to transplant to potentially cure this disease, an aggressive blood cancer. So I can share like multiple stories, but that little like a less than 40-year-old leukemia patient who's battling her second cancer, and you get to go on this journey with them, just motivates me to do this every day.
That's amazing. Thank you.
Yeah, I think that this specialty, I mean, I know I'm biased, but I think is very it's very unique and it's very special because the relationships that you create with your patients and their family members and caretakers is unlike, I think, any other in medicine. It's a very, very vulnerable spot that these patients are in. And you're kind of walking with them through this very delicate journey. And it doesn't end, as a medical oncologist, it does not end once they're done with chemo. This is long-term. These are years of, monitoring them in surveillance or years of them going through metastatic breast cancer. So I have so many inspirational stories. And I just remember this one patient, when I met her, she was very adamant against chemotherapy. She didn't want it. She just couldn't believe that she even needed it after surgery. And we talked to her and kind of eased her concerns, and she went through it and she said, wasn't that bad? And she said, like, I'm just happy to be alive and I love my life. And she's like, that kind of positivity reminds you, like, every day, the little things don't mean anything. And so it's a daily reminder. And that's why this one of the reasons that I love this field so much, because it's very humbling and it really brings you back to just like the simple things in life that we just have to remember and be very, very grateful for.
That's amazing. Thank you for sharing.
Yeah. So for me, I totally agree with what they're talking about. For me, I have a family member with the GI cancer history, multiple family member on my mother's side, they end up with the GI cancer. So I think it is very important area need to be further explored, because so far for the GI cancer, we still don't have a good treatment option. Unfortunately, I didn't end up with GI, but I think hem-onc is very promising, and it do definitely need more people to work on this area to help people improve the survival and figure out whether we can do the screening or prevention early stage to prevent especially some patients end up with a stage 4 diagnosis. Yeah.
These are all very inspirational stories and thoughts, and I think maybe you'll sway me at the end of this webinar to maybe go into hematology oncology. So some questions about fellowship. What, in your opinion, are some of the key qualities that you look for in applicants, specifically in hematology oncology fellowships?
I can start. Avan does a lot of fellowship interviews, so she can tell you more. But I think in general, because it's such an evolving field, of course, it depends on the program, right? But most programs do look for some research background because they want to make sure you are keeping yourself up to date. You're trying to, read up on things and also contribute to the field. Of course, I know we don't like our USMLE scores, but they always matter too, because they want to, all programs want to make sure that, good test takers are always going to be good test takers, right? That, you pass your boards and everyone wants good board pass rates. I think the other thing they look for, not just publications, is just interest in the field. And it's how do you express that interest, whether it's through volunteer work, whether it's through presenting at meetings. It's just things that you have done to show that you genuinely are interested in that field, if that makes sense.
Thank you.
Yeah, I would agree. I think you do have to have some research interest and publications, but when I interview fellows, I am looking at the whole applicant. So of course, I'm looking at your scholarly activities, letters of recommendation, but also, if you have other interests, I want to hear about that. I want to know, like, if you have a cool hobby that you really enjoy doing, or, there's something else that you're passionate about. Like, I want to know that, because it will come out in the interview. I mean, if you're not passionate about what you do, or, those kind of things, I mean, we can kind of tell. So just keep that in mind. And, even if you don't have that many publications or that much like scholarly activity, but you have, some other things that you work on or do, that's okay. But just come and know, like, okay, this is what I'm passionate about, and I want you to know that.
Yeah, I totally agree. I think your research or your other performance which make you stand out, or if you're very interested in for the example education background is also important too, because working in the academic, they need a lot of people who interested in teaching, organizing, arrange everything. On top of that, if you can contribute to research, definitely that will be a plus. So I do remember doing my when I doing my residency training at Avan House. I think I see my colleague very enthusiastic participate in the research project with all the attending. I think that's a good start to let you know how to participate and to get to know which area that you're really interested in. Yeah, so that is what I want to say.
Thank you.
Another thing, I'm sorry, Zain, another
go
thing
ahead,
that I
please.
just thought of was, and I know this is easier said than done, but like bigger university programs do pay attention to who wrote your letter, right? Of course, you want a strong letter, but then sometimes if it's a person that they have known or, has contributed to the field, that really, really helps. So for people that have multiple letter writers, it might help to see, who has a more, has contributed more, potentially knows more people. And I during my fellowship trail, I had multiple people comment about a specific attending who had, who was very well known, that person wrote you a really good letter. So
Thank you. And I'll go off of that and ask, what qualities or achievements do you think applicants should ask their recommenders to highlight in their letters of recommendation? What is impressing from your point of view?
Yeah, definitely. I mean, if you have a strong support letter, that will be helpful. Reputation is always important, especially in the academic setting. If you have opportunity to work with some like big guy in that field, if they provide their, a very strong recommendation letter, usually it's much easier for you to get the opportunity to be interviewed. And sometimes if you work with them in the past, you can get more chance to, get a higher level publication or very good trial opportunity to participate in writing RB protocol, all the stuff. You get more practice, maybe more challenging, but more opportunity as well. Yeah.
Thank you.
And I think, you know, you may come from an institution that maybe doesn't have like the big names, so to speak, and that's okay. That is okay. I think what we're looking for in letters of recommendation are, yeah, I mean, they have your CV. The letter writers have your CV, so they're going to talk about your accomplishment, everything that we can read on your CV as well. But I'm also looking for character. And I mean, I can read between the lines in a letter of recommendation. So I can really, truly know when a letter writer is being very genuine about like the applicant and in how they're describing the person. So, you know, I think character, how they work in teams, how they work with each other, how they work with the hospital staff or the clinic staff, those kind of things are just as important as your activities and other things on your CV.
Yeah.
Thank you. I love that. And that kind of takes me to the second portion is the personal statement. What makes a personal statement memorable to reviewing thousands of applications? What makes one personal statement stand out for you?
I think again that I think the same thing that we were saying is, of course, everyone has your CV. So more than talking about your accomplishments in the personal statement, it's kind of like painting a picture of who you are as a person, what brought you to that point in life, right? Why you chose medicine, what did you do in residency, and what brought you to that point that you're applying for a fellowship, what shaped your career, and what your future, you know, we want to, it's kind of, they want to know you as a person, right? They've already read your CV, they've read your letters of recommendations, they know how accomplished you are, what publications you've done. At that point, they're trying to know you as a person. So I think that's how I think of it, and that's how I kind of take it.
Thank you.
I am certainly not an expert in writing or creative writing, but some of the letters that have really stuck out to me, I think I remember there was an applicant who was a ballerina, and she was talking about like ballet, and then like wove it into her experiences with oncology and other things. So that like made me remember, okay, oh, this is the ballerina. And when I was interviewing her, like that reminded me of her. So if there is something, again, something that's unique to you, and you try to like kind of incorporate that in part as in part of your personal statement, that makes you memorable. I mean, I know like it's not the easiest, but try to be creative with it. And because you will stand out, because we have these little mental notes in our mind. Because if everybody has the same personal statement, then it's hard to kind of distinguish between everybody. But I distinctly remember the ballerina dancer.
Yeah, that sounds good. Yeah, one thing I want to add on is when you write the personal statement, try not to use too fancy word. For example, if like, oh, that is what I heard story from other students. So he writes a template for his attending from one of the recommendation recommendation of the letter. And they mention, oh, this student is the smartest one I have ever seen. So that is really objective, and it's, you know, so make people laugh when they saw this letter. I would say just try not to use this like the most, or, you know, too fancy word. We can try to use more story, more detail, to let people know better what person you are, what achievement you have done. But do not just use a lot of the good words, you know. Let's just make it looks like not mature, you know. So that is some mistakes some students sometimes will make. I will try to avoid that. Other than that, I would say, your experience, your research, your training in the past, they all contributed to where you are now. So you can highlight the things you think can stand out you most? With the detail, with the story from other people's standpoint or from your colleague. Do not use too much like I think I can blah 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 blah. So that is not something you want to say. You want to say more detail. With the more story, it's some truth. It's not something you want to be. It is something you have done in the past. So that is the some mistake I saw my colleague make in the past. Yeah.
Thank you for sharing that. And that kind of brings us to any other mistakes that you have noticed in applications that could be avoided, to give some tips to the applicants.
I think when it comes to publications, for me personally, it's not so much quantity, but it is the quality. I oftentimes will see a bunch, like 2 pages of publications, but they're not really like quality, or maybe the person was added as an author, but they didn't necessarily do a lot of work on it. I don't know, but it just seemed that way. And then when you ask, they can't really talk about it. So it's really, for me, the quality of your activities and not the quantity. So just be careful of that. Like, if you want to do a ton of like, if you're spreading yourself too thin, for example, with your scholarly activities or your research, we can kind of tell. But if you pick 1 or 2 passion projects over your 3 years of your residency and you work on them, and then number 1, you're confident that and passionate when you talk about them in your interviews, and then we can really see that come through. So just try not to do a lot of filler stuff on your CV. Just be careful of that.
Thank you for sharing that.
Yeah, no, sure, I agree. And I think the other point I feel like, I know it's easier said than done, is to decide early what you actually want to do in the future. Again, it's easier said than done, but if you want to be a community oncologist, like a big academic place might not be the best for you to do fellowship, because you will not get the bread and butter training that you would need to put in practice in the future. So it's always helpful to give a thought, because I know it's a race, right? I was an international graduate. You graduate med school, then you do USMLE, then you do residency. You never get a chance to sit and think and pause. What do I actually want to do 3 or 4 or 5 years from now? What gives me happiness? So if you really want to be a community oncologist, going to a community program where you see a lot of volume, you see a lot of bread and butter cases. So I think one mistake that a lot of people make is to just be in that race and not give it a thought that, do I want to be an academician? Do I want to be a community oncologist? Do I want to be somewhere in between? And a lot of times when we're in that race, we don't actually know the difference between all of these things, because if you come from a community program, you have not seen what academics is like, and vice versa. So, talking to more people, seeing what their life actually looks like, what does their week look like, how many days of clinic do they do? It's nice to inform yourself so that you can make the best decision for yourself.
Thank you. How do you believe applicants can assess programs when they're interviewing to see if they're a good fit in that program, if it matches their career goals or even personal goals?
I think some of the things that I just said kind of go over there too. Like if you're going to be a community oncologist, you want to see, what people you're going to work with. Another thing that I really liked was to ask if they have a clinic for the fellows, because when you have ownership of the patients, like where I trained or where all of us trained, we had a VA clinic where they're your patients, you get to see them, you staff them with a general oncologist, and so you kind of learn a lot that way. Versus a lot of fellowship programs where you don't have your own clinic, it's basically the attending patients and you're just seeing them with them. You don't get a lot of ownership and not a lot of continuity of care, and kind of seeing the whole story through from diagnosis to treatment to potentially cure. So having a fellows clinic is sometimes nice like that. But I let Avan and Lingbin add more things.
Thank you.
I think that's really important. And I think the other thing, I know at my fellowship, and I know at Akriti, the fellowship program. There are, I think more fellowship programs are doing this where they have individual tracks. And I know residency programs do this now, but for fellowship programs, having different tracks that are more catered towards what you're interested in, whether it's QI, more research, more clinical, that kind of thing. So, for example, when I was in fellowship, I was more on what we call a clinical or like an educator type track. So with that, I actually had a lot more like rotations, inpatient rotations and outpatient clinics rather than protected time for research. I still was able to do research, but I was more clinical heavy, which I wanted. I wanted a lot more exposure from the clinical side. Now, my colleagues or my co-fellows who did the research track, they were the balance was more tipped towards research. They had more protected research time. They still had their own clinic. They still did inpatient rotations, but it was just that balance was different. So I think having those specialized tracks that are offered in the fellowship program is important because we're not all the same. We're not, one size doesn't fit all. So it's important to have that that is kind of catered towards what you're interested in and what your ultimate career goals are.
Yeah,
Thank
yeah,
you.
I totally agree. That's a great point. It's very important to know what you want before you join the fellowship program. That is why the interview is very important. During the interview, you need to familiar what this program focus on. Even though sometimes they have the different track, some program good at hematology, some are program good at oncology, some may be very strong in thoracic but very weak in breast. So if you already have your goal before you join, it's better for you to know the background about this program. There are several resources you can go for. You can talk with the attending or the fellows during the interview to ask them about background. Or you can go to the website. There's a lot of the website have very detailed description about the ongoing research project, how many trials this site has been opening, a lot of the information there. Besides, sometimes you may not so clear what you want to do before you join the program. For example, I know a lot of the fellow, they don't even know want to do oncology or hematology when they join it. It's totally fine. Because you will not know it until you do clinic practice, right? Sometimes the interest comes after the clinical rotation. So generally speaking, majority of the program provide very good training resource on both research and clinic. For example, at our school, at the first year, usually you have the full exposure to both hematology and oncology. And at the second year, you can tell your program director, hey, I just want to focus on hematology only. And then you can even choose a single board. You don't have to take both. So that saves you a lot of time and you can focus on only hematologist, clinic, rotation, and the research. So this is a lot of the adjustment you can try to negotiate with the program even after you join in.
Thank you for sharing that.
In
Yeah.
interviews, I would avoid asking things like call time, vacation time. Those things will come up in conversations, but I just would, as the interviewee, I would just avoid. I mean, you don't really need to call this call. It's not going to be, but I just try to avoid those kind of conversations, in my opinion.
Yeah.
No,
Thank you.
I agree with that because call's going to be same for all the fellows, and then when you become an attending, you still have to do calls. So they're never ending.
Yeah, it never ends.
So shifting gears a little bit into lifestyle, how would you describe a lifestyle of a fellow of a hematology oncology?
I think the first year is the hardest. It's a lot of clinical rotations. It's a steep curve, right? You at that point, you know everything about medicine, but suddenly you have to know about breast cancer and lung cancer and gastric cancer and all these different types of cancers and all these chemotherapies and all these targeted therapies, and everything has two names because we like to make it complicated. But I think the first year is the hardest. Most fellowship programs have the most call in the first year, have the most inpatient or consults or clinical rotations, and then it gradually gets better in the second and in the third year. Of course, it depends from program to program. A lot of programs are 18 months clinical, 18 months research. Some programs are completely clinical. And even in the 18 months clinical, 18 months research, a lot of that 18 months is in the first year. So almost between 6 to 9 months. And then it's lesser and lesser call, lesser inpatient rotations, more time to do research and kind of focus on what you want to do.
Perfect. Thank you.
Yeah, absolutely. The first year is the most difficult one. And unfortunately, Akriti and I both gave birth in the first year. Yeah.
We both had babies in the first year, so you can do that.
Yes, yes. So now you know, first year is not best time to do that. In the second year, the third year is much better. The third year you're probably busy with interviewing, job interviewing. That is time consuming. So I would say if you want to do academic, probably second year is the most important year for you to do the research, because at the third year, it's kind of a little late to do the research, which you already have some like a publication or some project that have some preliminary data. So I would say first year more clinic, second year more research, and the third year is the job hunting. Yeah.
Yeah.
Thank you.
And talking about babies, I had my first one in first year and then second one in third year. So it's fellowship can't be.
That's good to know. I'm sure the audience is super excited to hear that. And another question is, how do you maintain the balance between the demanding aspects of the profession of being an oncologist and your personal life?
So I think, so oncology is very emotionally and mentally very difficult. I'll be very honest with you. And you really have to be prepared for that. I think you have to be able to leave work at work. There are moments that are very, very hard at the end of the day because you have very hard conversations every single day. You have very, very challenging conversations. They're sad. So be prepared for that. And it's going to be for your entire career. It's going to be like that. So it is, like I said, this is the most humbling, rewarding career that you could do. But you also have to remember that it is also emotionally very, very challenging, and be able to have your tribe, so to speak, that you can lean on, especially your colleagues, because we're all kind of experiencing the same thing. I mean, you have your family, your friends outside of medicine, but the ones that your co-fellows, for example, that you were together with, or your colleagues now in practice, and be able to lean on them, because it can be very challenging at times. Heavy. It can be very heavy, I should say.
Thank you.
Yeah, I agree. I think the most important thing that Avan said was to leave work at work, because you're going to keep thinking about these, it's easy to keep thinking about your patients, especially when you're inpatient, like they're still there. You're still thinking about them. Cleveland Clinic does this thing where they give you a work phone. So I have 2 phones now. So what I do is I put my work phone away when I come home, so that I don't look at that email. That email can wait until the next morning, right? It's important to have that time that is undisturbed, that you spend with your friends and family, or spend on yourself, like to exercise or to do other things, or pursue your hobbies, or do other things. So
Thank you. Yeah. I mean, lifestyle is also always important. I totally agree with what they say. I mean, oncology, majority of patients, sometimes with very poor prognosis. That is why you're dealing with the family. It is not one human being. The patient have the son, have the husband. You just work with the dynamics. and try to find, the best balance and help them to make the decision. You still want to keep your life not so be affected by your work, especially sometimes in a patient you probably have a 2 patient die, but the life should go on. Just how to cope with it and adjust yourself.
Thank you for sharing that. If you could recommend a book, medical or non-medical, for someone who's interested in hematology, oncology, what would that book be? If you have any.
Yeah, I think one book that at Cleveland Clinic, every fellow gets, and most of us have heard about it. It's on my book list of books to read, is When Breath Becomes Air. It's by Paul Kalanithi, who was a neurosurgeon, and he was diagnosed with lung cancer and he passed away. So it's kind of like, again, thinking about, what you did in life and how you kind of learn from it or introspect or things like that.
Thank you.
I became a reader. I will admit, I became a reader during COVID. I never thought I would be like joining book clubs and all these things. So I guess I don't know if this is necessarily medical, but my probably top 3 favorite books, they're all like, just like for fun reads. So it's not really medical. The Where the Crawdads Sing, which became a movie, and then The 7 Husbands of Evelyn Hugo. So if you guys are looking for reads just to get away from the world. And then the other one it's about the octopus in the aquarium. I'm blanking on I can see the cover of it. If anybody in the audience remembers this, but I'll remember the name. But it's a great book too. It has nothing to do with medicine, but those are my top 3 things.
Thank
Yeah.
I think if you're looking for oncology things, I think it's hard sometimes if the things are changing so quickly to keep up with like textbooks. I think, up to date everyone still uses. It's one thing that's easy. I think another resource that a lot of people don't know about is NCCN. You can make a free account. And so it's called National Comprehensive Cancer Network, and it has all these guideline panels, and it's not just like complicated graphs, but there's also text in the end that you could, potentially read if you're seeing a breast cancer patient or a leukemia patient, you can always, look it up and see what treatment that person got if you want to inform yourself. But you're going to do this in 3 years of fellowship, so you don't need to, but if you want to.
Yeah, I also have one book to recommend, which is The Pocket of Oncology. The reason I recommend that is because it's very small, it's easy to carry in the white coat. So it's not heavy, it's very convenient. It has the most important highlights for each type of the cancer. But if you're looking for more detail, I would say up to date may be better. Yeah.
I love all of the recommended books. Did you have something else to say, Dr. Armaghani?
I was going to say it's called Remarkably Bright Creatures. All 3 of those books, you won't go wrong, especially 7 Husbands of Evelyn Hugo. I could read that book again and again. But anyway, I digress.
Thank you. I love those recommendations. Where do you see the field of hematology oncology heading in the next decade or so, since you're inside?
I think from a breast cancer standpoint, we finally made the breakthrough of use of immunotherapy in breast cancer. So that was huge. And I think for most cancers, it's a lot more personalized, tailored therapies, looking at mutation analysis of the cancers, looking at more targeted therapies. So I think that's kind of where, definitely in breast cancer, that's where we're moving towards.
Thank you.
And I agree, targeted therapy, of course, is where everything is going towards. I think cell therapy is progressing a lot. We just started a new cell therapy service, and it's being used for everything. It doesn't work for acute myeloid leukemia yet, but all kinds of blood cancers and even solid tumors. There's bispecific for lung cancer, and there's all these tumor infiltrating lymphocytes for melanoma. So cell therapy, is that something to keep yourself informed about? Is interesting.
Yeah. Yeah, I would say cell therapy, immunotherapy, is most two hot topic field recently for the solid cancer. For the immunotherapy now, like a PD-L1, always like NK cell in IL-2, IL-6. There's so many trial and study ongoing. Oncology, and there's even thinking about the marrow transplant to treat the solid cancer as well. It's very fast growing. It probably will change in next 3 years. For the last result of the treatment, everything changed to the cell therapy. That is possible. Yeah.
Thank you. So outside of your professional world, what keeps you motivated and even going, facing all of these challenges and, like we said, hard, heavy stories and lives that you encounter? What keeps you motivated?
I think I know a lot of the patients are hard, but then there are some patients you can cure, right? When you get to tell the patient that, we've cured you, we're just going to monitor you, that keeps you going. And then other than work, I think it's really important to give time to friends and family and, bringing kids up. I have 2 little ones, and it's important to realize that I tell myself that work is not everything I do, right? That's not all of me. I have another person outside of work. So just not losing sight of that is also always important.
Thank you.
Yeah, I completely agree. I think it took me a while to realize that work is work, but yes, there is a life outside of work. And, I think even in residency, even medical school, I mean, we get kind of caught up in all of this work and, all these other things. And then we kind of like time just flies by, and then you're like, well, what happened? And I think in oncology, especially, you learn how like fragile time is, right? And time is not infinite. And so having that mindset now has really kind of driven me to do a lot of things that, maybe you'd think, okay, let me just hold off on doing that. But no, I mean, like I learned the piano. I didn't think I would, like, whoa. I started ballroom dancing. Who am I? Like, why, but I thought, well, if the time is now, like pursue what you want to do outside of work, because there's so much life to live, and just please take advantage of that. It's not like, well, I'll just wait to do this after fellowship or after resident. It's you always can make the time. So just, if there's something that you've always wanted to do, or place that you've wanted to travel or do something with your family, don't wait on that, because I think every day we see, the kind of, there's like a finality of things sometimes. And so you just don't want to waste another second. That's kind of how I feel a lot of times.
Yeah.
And we might sound pessimists, we're sorry, but it's like, I see a lot of old patients, and I always ask them, when did you retire? And do you feel that it was the right time to retire? Because I've had so many patients, like I had a recent acute promyelocytic leukemia, right? The best leukemia to have, you can cure it. And he was like, I retired at 65, which was 6 months ago. And now I have this, right? So it's kind of, it puts you into perspective. Like you make all these timelines for yourself. This is when I'm going to have kids, or this is when I'm going to get married, and this is when I'm going to retire. I'm going to work these many years to put this much money into retirement so that I can retire at this point in time. Like Avan was saying, like time is not infinite. It always doesn't follow those rules that you set for yourself. And it's important to give yourself, some grace, give yourself time, and do what you love to do.
Yeah, there are so many workaholics around us. It's very important to know when it's enough. And it's hard. Sometimes you just think still have to do something more. But I think I totally agree with what you say. I think we should know how to balance the life and the work. And you know, we all have kids, and they growing up every single day. I don't want to, you know, just lose these days which I should spend with them. And I think it's also important. So let's just try to do better.
Definitely. Thank you for sharing all of that. One of the last questions that I had was one piece of advice that kind of stuck with you throughout your medical journey.
I think we all just gave that advice, is to use time to, to the most of, do what you love. Of course, we all love work. We're passionate about it. That's why we, wake up every day. And that's another point, that choose to do what you love, right? You want to be motivated when you wake up that Monday morning, that you like going to work. If it's feeling like you're getting the Monday blues, you're probably not doing what you should be doing. You should probably think about it again. So choose what you love, choose the job that you like. They're not all the same. There's various ways of doing things, and even academics is not the same everywhere. Communities is not, you can choose 0.7 FT full-time equivalent, like just do 70% of the work if that's what motivates you, right? So it's important to think what you want and then we'll work towards it.
And I think also, I mean, I completely agree with that. And don't be afraid to ask questions, and always be curious, and always be wanting to know more. I'm 6 years into this, and I'm still, working with my colleagues. We're always talking about cases, asking questions. You're always going to have, you have your bread and butter cases, but then you have your challenging ones, and you got to collaborate and you got to work together, and just always keep an open mind.
Yeah. I mean, every day, I totally agree. Every day, the knowledge is so changing every day. So we should keep updated. It's very important to communicate. You always learn something from others if you communicate with them. Yeah.
Right. And that's, I think, another part that comes where there is like humility and being humble. Not everyone knows everything, right? If everyone knew everything, it would be a very different world. So just realizing that you can always learn something from, the intern or the medical student, like even they can teach you things. So just being open to discussing things, talking out things, and just imbibing knowledge everywhere you go.
Perfect. Thank you so much. I'm going to open it up for the audience to see if they have any questions. I have one question. I'll read it out. What opportunities for applicants and programs, if any, would you recommend for learning more about the program, faculty, networking, or meeting? I think we kind of addressed it, but if there's something else that you would like to add for that.
Yeah, program websites are, of course, like the easiest thing, but of course, it depends on how updated the program websites are. And again, another point, most of us are friendly, so feel free to reach out to anyone. Worst case is that they won't respond to your email, which is fine, right? But someone might respond. And it's not like they're trying to ignore you. It's just the email probably got lost in the big. So email them again. So don't be afraid to reach out to people, find connections to reach out to people. I think for networking or meeting, the big two conferences that we all talk about is ASCO and ASH. ASCO is the American Society of Clinical Oncology, and ASH is American Society of Hematology. But they're really big. It's easy to get lost. So you find a friend that can take you there and introduce you to people maybe sometimes. Those are some of the things I can think about.
Yeah, thank you so much.
Yeah.
And I think if you had like co-residents who were above you and then they're off into fellowship or beyond, maybe, and you've already had like a friendship or a rapport with them, you could reach out to them for some advice, or even just like your existing mentors that you have. That's a really good stepping stone as well, because I have mentors that have introduced me to other people within the field and so on. That has always been great.
Yeah. And I think if you have this opportunity to talk to some like students or friends, who just 2 years or 1 year above you from that program, that will be very valuable resource because they can tell you from different standpoint. If you reach out attending, they probably, if he's nice to respond to you, he probably just tell you some like ongoing study and interest in the research. But if you talk to some students or like fellows, like just 2 years above you, he can tell you more from like a training, the schedule, how about the work dynamic, how about the environment, how about the job hunting, a lot of things from your standpoint, which is more useful. Yeah.
Perfect. Thank you. We have one more question. So for people who have already applied this cycle after the interview, what steps should applicants take to reinforce their interest in your program?
I mean, I think follow up with either an email or a card just saying thank you for interviewing, and just to express your interest that way. Because I mean, I remember those people that email me and say thank you for taking the time to interview me. I think that's important.
Yeah.
Yeah.
And sometimes if you got some updates, just don't be afraid to reach out to them. Say, hey, I just have this publication recently. I want to share this good news with you. Just try to, fresh them and make them remind you and know your interest in the program.
Perfect. Thank you. One more question. How and at what points in your career did you figure out your individual interests, breast oncology, leukemia, or genitourinary oncology?
I think my first clinic was in the myeloid clinic or leukemia clinic, and I just fell in love with the teachers or with the attendings I worked with, and I never looked back. Another I think side to that is it's always okay to change what you want to do. It's never too late, right? So you might start somewhere, you might want to think that this is what I want to do, and then you might find something. I mean, of course, you don't want to keep changing, but it's okay to make that switch if it's never too late.
Yeah, totally. For example, at first year, I did more GI oncology rotation. At that time, I think, oh, I probably will end up with the GI. I did all the research about the GI, get all of the trial training, the protocol, the stuff. However, when I go to second year, I thought, oh, I think, the GU is more interesting. So I switch. And then I end up doing GU. So it's totally fine if you change your idea during the training. And what you have done is all the achievements you have made. And there could be all your credits when you apply for the job. It doesn't matter, oh, I did some thoracic, it is not related to the GU. No, and everything you've done to make credits for you. Yeah.
Thank you.
I think you'll kind of know and learn if you want to specialize in one specific area versus doing everything, like more in a community practice. I know for me, I'm the best at like focusing on one thing. I have the utmost respect for those in community practice and having to keep up to date with everything in hematology and oncology. It just wasn't, I knew I wouldn't be able to do that. So I knew I wanted to do one thing, and I knew I wanted to do solid tumor. And then, yeah, I mean, I had an amazing mentor. I remember the first time I saw the NCCN guidelines for breast cancer, I took one look at them and I closed it because I was like, this is crazy. And now, now it's like, second nature to me. So, that's, I fell in love with breast cancer, in my first year of fellowship. And, so really try to kind of gauge, do you want to do like a single focus or more broad? Do you want to do more solid tumor or heme? Those are the kind of decisions to make.
I think
Thank
another point that goes into that decision is what are you most tied to? Are you tied to a location, or are you tied to a disease group? Because if you're really tied to a location, like if I was like, I'm going to stay in Tampa, I don't want to go anywhere else, then I have to be flexible with what I want to do, because job market changes from year to year. And if I'm tied to a specific cancer, I'm going to have to move, right? That's why I had to move, because I couldn't get a job in Tampa because I was so fixated in treating leukemia. So I think it depends on what's more important to you also. And I agree with Avan. I couldn't have treated everything. I mean, it's so hard. So I made a decision on, which niche I want to choose.
Yeah.
Thank you.
And it seems if you choose to do the private practice, it seems your option may be more broad than the academic. Because for my opinion, I find a lot of my colleagues choose private practice, get job offer from all over the place. But for academic, it will be very limited, because for institution or university, probably they only want breast cancer doctor this year, or only thoracic this year. So that will be a little limitation. You probably should take into consideration. Yeah.
Thank you so much. There's one question that I don't want to leave unanswered. What are some important questions to ask fellowship programs on the interview trial?
One thing I wanted to add about interviews that just came to my mind, and this may be part of that question, but if you know who's interviewing you ahead of time, maybe keep in mind one fact about each one of those interviewers. Like, you can look at their bio online and see maybe what their area of interest is, or like sometimes they'll say like what their hobbies are or something, and keep that little fact in mind, because then you can maybe like strike up a conversation with them, towards the end of the interview or whatnot, because we love to talk about ourselves too, right? So, but that's, like you're expressing your interest, and you're familiar with what we do and what our passions are. And so that's a nice little conversation starter. So I sometimes would remember that during my interviews.
Yeah, I think, and that's important because the interviewer has also taken time to read your application, right? Read your long application and get to know you. So it's even though it might seem trivial, but it's sometimes important to also know your interviewer. Then you can, like Avan said, strike a conversation or just genuinely seem interested.
Yeah. And one small point, maybe no one will make that mistake, but do not ask negative question. Like, what is the weakness of your program? Do you think? Never ask those questions.
No. Yeah, agreed.
Thank you so much. I'll just check the chat. If no one in the audience has, one more question. Are there any recent research opportunities that they can participate in with all of you?
I think with from a different institution, I think the easiest things to do, and you can reach out and us, depending on what you're interested in, is maybe review articles or anything else. It's hard to do because you don't have access to EMR and it's different patients. Maybe some part of case report, depending on if someone has already written it. Of course, there's meta-analyses and kind of those opportunities too, but I'm not a meta-analysis person. I don't know how to do that. Maybe Lingbin or Avan know.
Yeah, I think there's a tons of the research opportunity. Like Akriti said, it depends on what you're interested in. If you're interested in hematology, you should reach out to hematology department for more research opportunity on that area. If you're interested in solid, I'm happy to contact with you and see whether this is some opportunity I can offer for you. Generally speaking, I think we can participate some like review paper writing or like a retrospective study, or like case report, which is more easier. There's also a lot of opportunity there. Yeah.
Okay, thank you. Is it possible that I can get your email then so I can contact you later?
Oh yeah, of course.
Anyone in the audience has any more questions? If not, then this will be the end of the webinar today. Thank you all for sharing your genuine insight. We appreciate your time, and Dr. Mercado is going to do a closing line.
Well, thank you so much, honestly, for attending our session tonight. I want to give a special thanks to our speakers. I think it was a very, very valuable webinar, so much insight and advice. And I will say, how powerful a mentor can be. Now I may even consider going into Hemo, after listening to all of you. Honestly, it was very, very good. I really, really appreciate it. Tomorrow, we will host our last episode on the webinar series focusing on gastroenterology. And I want you all to remember as well, whether you are a PGY 1, 2, 3, you become an attending, a fellow, please remember that the ACP will always be your home as an internist. We have lots of opportunities for residents, fellows, early career physicians that you can grow in leadership, education, and advocacy. Avan is actually the co-chair of our Council of Early Career Physicians. So if any one of you is interested in becoming involved with our chapter, any of our committees, the Council of Residents, please let me or say no. I'm going to put my email right here in the chat so that anybody who may be interested in joining our initiative, please let me know. Spread the word of our chapter. Attend our annual meeting. It's a great opportunity to expand your network, meet peers, just know what's happening in the field. Remember, you can submit abstracts for the conference until August 19th, and all submissions count for your CV. I know sometimes, doing the poster, recording the poster, and all of that, like those extra things that our ACP Florida chapter has for the meeting may be a little bit cumbersome, but if you do it, it already counts for your CV. So you can already put in the CV, poster presented at the ACP Florida annual meeting. What we do is a prelim judging, and then afterwards, if you get selected, you go to the finals, and you can say poster presented in the finals, but that's a different thing. Thank you all. Thank you, Avan, Lingbin, Akriti. Thank you, Jain, amazing moderator, excellent questions. God bless you all. Thank you.
Thank you.
Good night. Bye-bye.
Thank you. Okay.